Meet Charles. He was so excited for his retirement. He had big plans to travel with his wife and spend time with his grandchildren. He loved riding the bicycle around his small town in Canada, staying active and enjoying life. But then something changed. Charles started feeling a constant pain in his lower back that never went away. There was no injury, no reason for the pain. It just wouldn't stop, day and night. He went to see a chiropractor, hoping it would help. At first, it seemed like a good choice, but after a few treatments, things got worse. The chiropractor's treatments caused multiple fractures in his spine, making his pain even worse. But it was this injury that finally revealed the real problem, a serious health issue that might have never been found otherwise. Join me in solving this pain mystery today. Charles had always been strong. In his 40 years as the manager of a busy warehouse, he walked miles, climbed countless stairs, and lifted heavy loads without a second thought. Every morning he hopped in his bike and rode to work, rain or shine. Back pain? That was something other people dealt with, not him. When he retired, Charles was ready to live his golden years. He dreamed of traveling with his wife and making memories with his grandchildren. But then, without warning, a constant pain in his lower back put those dreams on hold. It wasn't just a little discomfort, it was continuous, unyielding, and it followed him day and night. After 4 long weeks, Charles knew he couldn't ignore it any longer. He visited his family doctor, hoping for answers. His health history was mostly uneventful, a minor stroke years ago, and an underactive thyroid, both managed with daily medications. Tests came back normal. Vitamin D, sodium, potassium, chloride levels were fine, and his urine test showed nothing unusual. But Charles had a mysterious past. 2 years earlier, his blood work revealed low platelets, hemoglobin, and white blood cells, a worrisome trio. Yet, without any treatment, everything had returned to normal, as if nothing had ever been wrong. Now, with this stubborn back pain, the question loomed, was his body trying to send him a message it couldn't ignore this time? Charles' battle with back pain was just beginning. His family doctor suggested starting with simple treatments, over-the-counter anti-inflammatory medications, and an X-ray of his spine. The results were frustratingly normal, showing no clear cause for his pain. Desperate for relief, Charles turned to a local chiropractor who suspected a mechanical issue with his back. The treatments began with spinal manipulations, but within 24 hours, Charles' pain grew sharper and more intense. Still hopeful, he attended 2 more sessions over the next 5 days. Each time, the pain worsened, leaving him in agony after every visit. Finally, even the chiropractor admitted something was wrong. He stopped the manipulations and told Charles to return to his family doctor. By now, Charles' pain was unrelenting. His doctor prescribed a muscle relaxant, cyclobenzaprine, and a sleeping aid zopiclone to help him rest. But sleep was impossible. Every moment was consumed by unbearable pain. 5 days later, Charles was back in the doctor's office. This time, the doctor prescribed a stronger medication, a combination of metocarbamol, a muscle relaxant, and codeine, an opioid for pain, and aspirin, an anti-inflammatory. Yet, even this potent mix barely touched the pain. Just 2 days later, Charles found himself in the emergency department, unable to endure the torment any longer. The doctors there examined him carefully. His vital signs were steady and he was fit with a healthy body mass index of 23.4. But his lower back told a different story. The pain was so severe that even the slightest touch of his lumbar spine made him wince. His movements were stiff and restricted, though his hips, legs, and neurological tests appeared normal. The mystery deepened, and Charles searched for answers, and relief continued. The blood test revealed a green picture. Charles had low levels of platelets, red blood cells, and white blood cells, while his calcium levels were alarmingly high. Something was clearly wrong. To dig deeper, the doctors ordered another round of X-rays for his thoracic and lumbar spine. This time, the results were shocking. Charles had fractures in 4 vertebrae, T11, L1, L2, and L3. These fractures hadn't been there just weeks earlier when the family doctor first checked. The spinal manipulations during chiropractic sessions had caused the fractures, but why had his bones been so fragile in the first place? The pieces of the puzzle began to fit together, and the situation became even more urgent. Charles was admitted to the hospital for further testing to uncover the cause of his fractures, abnormal blood count, and high calcium levels. A specialized test, serum protein electrophoresis, was performed, and the diagnosis hit like a thunderclap: multiple myeloma. This blood cancer doesn't just attack the blood, it weakens the bones, leaving them vulnerable to fractures. More X-rays of his arms and legs revealed the full extent of the damage. Bone lesions riddled his humerus, femurs, silent evidence of the toll myeloma had already taken. What can we learn from Charles' journey? First, not all back pain is simple. While most cases are harmless and self-limiting, some hide serious illnesses like cancer. 2. Fragile bones and chiropractic care don't mix. The spinal manipulations caused fractures because Charles' bones were weakened by an undiagnosed disease. 3. Red flags matter. Before starting chiropractic treatment, a thorough history and physical exam are crucial to spot risks like bone diseases or systemic conditions. 4. Timing is key. X-rays taken before the manipulations showed no signs of multiple myeloma, but after the fractures, the pieces finally came together. 5th, warning signs were there. Pain at rest, at night, combined with Charles' history of low blood cells 2 years earlier, hinted at a deeper problem that had been overlooked. 6. Caution is essential. Chiropractic spinal manipulation is generally safe, but extra care is needed for patients with risk factors like osteoporosis or systemic diseases. 7. A shared responsibility. Family doctors, emergency physicians, and chiropractors are often the first line of care for back pain. It's their duty to take a detailed history, perform thorough exams, and identify red flags before deciding on a treatment plan. Charles' story is a reminder that not all pain is what it seems, and that looking deeper can save lives. These pain mysteries happened in real life. They are published in medical journals as case reports. You can find the reference in the description of this video below. The name of the patient is fictitious. If you like this video, consider subscribing to this channel. And if you're interested in learning more, check my courses on YouTube. And please remember that this video is not intended to provide medical advice. If you have any condition, a painful condition that needs proper diagnosis, consult your doctor. If there is any emergency, call an ambulance or go to the nearest emergency department. This video is for educational purposes only. Thank you for watching. Goodbye.